Hey everyone, today we're talking about a very common medication, salbutamol, also known as albuterol. If you or someone you know has asthma or struggles with breathing issues, this one's for you. Let's break it down. What is salbutamol? Salbutamol, or albuterol, is a bronchodilator, fancy word, right? Basically, it helps open up your airways, making it easier to breathe. It's commonly used for conditions like asthma, chronic obstructive pulmonary disease, COPD, and other breathing problems. You'll often find it in inhalers like Ventolin, ProAir, or as a nebulizer solution. So, how does it work? Well, salbutamol works by relaxing the muscles of the airways into the lungs, allowing them to open up and let more air through. Think of it like unlocking a door when you're stuck in a crowded room. Suddenly, you can breathe freely. When should you use it? If you have asthma or a breathing condition, your doctor might have prescribed this for quick relief during flare-ups. The key word here is quick. This is a rescue medication, meaning you take it when you feel short of breath or experience wheezing. It's not for long-term control. That's a whole different type of inhaler. Common side effects. Now let's talk about side effects. Like any medication, salbutamol can come with a few. The most common ones include shaky hands or tremors, increased heart rate, nervousness or feeling jittery, mild headache. Most of these are temporary and harmless, but if they become severe, talk to your doctor. When to seek help. If you experience chest pain, a pounding heartbeat, or worsening breathing, even after using your inhaler, don't wait. Get medical help immediately. Also, if you find yourself using your inhaler more than usual, that could be a sign your condition isn't well controlled, and you might need a different treatment plan. Tips for safe use. A few important tips to remember. Number 1, remove cap. Some must be squeezed at the sides to release. Number 2, check dose counter if device has one. Number 3, hold inhaler upright and shake well. Number 4, breathe out gently, away from inhaler. Number 5, put mouthpiece between teeth without biting. And close lips to form good seal. Number 6, start to breathe in slowly through mouth and at the same time press down firmly on canister. Number 7, continue to breathe in slowly and deeply. Hold breath for about 5 seconds or as long as comfortable. Number 9, while holding breath, remove inhaler from mouth. Breathe out gently, away from inhaler. Number 11, if more than one dose is needed, repeat all steps starting from step 3. Number 12, replace cap. And that's a wrap on salbutamol. I hope this helped you understand how it works and how to use it safely. If you found this video useful, don't forget to like, share, and subscribe for more medical insights. Got any questions? Drop them in the comments below, and I'll be happy to answer. Until next time, stay healthy and take care.